Greetings, and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Pam Fields, State Director of Advocacy and Access for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 100 state legislative victories across the country since 2014, including the new law on prior authorization in Indiana. But what do those victories mean for patients and their access to care? The Arthritis Foundation has got you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We're here to help ensure that your new protections are implemented fully and that patients in your state know their rights. This includes providing resources like this webinar that explain the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the prior authorization law in Indiana that was fully implemented in September 2018 and what to do if you feel the law has been violated. Typically, physicians must fill out a prior authorization form whenever they prescribe a specialty medication or treatment that is restricted or not covered under the insurer's formulary. Each insurer uses its own unique form, and physicians may have to spend many hours of familiarizing themselves with and completing dozens of forms of varying lengths and complexities. As a result, prior authorization typically causes lengthy delays in treatment, thereby restricting a person's access to vital care. Now that there is a law in Indiana on prior authorization, we want to make sure you know what that means. The law standardizes prior authorization protocol and streamlines access to vital medications and treatments for people with arthritis. This bill leverages technology to improve pharmacist efficiency in community and health system pharmacy settings, thus reducing pharmacist time and employee expense in securing prior authorization from physicians. Who benefits from this new law? The bill impacts commercial insurance plans in Indiana that are not otherwise governed by ERISA-protected self-insured plans. To learn if you are covered, contact your insurer and provide your policy number. So what do you do to begin the appeals process? Ask your pharmacist what they heard from your insurance company and write it down. Call your doctor and report the problem. See if they can suggest next steps to get your medication. Call your insurance company and find out how to appeal the decision. Your physician often needs to intervene and write a letter. Share copies of any insurance letters and information you receive with your doctor. Make sure you stay on the same page. Check with your Human Resources office to learn the specific rules to your plan. Check to see what measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. Call your insurance company to find out why your medication did not receive approval. The number to call should be on your insurance card. Find out if your appeal needs to be online or there is another process from your insurer. Keep notes of all conversations, who you speak with, dates and times of calls, and case reference numbers. Having good records helps move future calls forward. Stay in touch with your doctor through the process and share information. Your insurance company must provide the reason for your denial in writing. Ask about it if you've not received anything. If submitting an appeal yourself, include all relevant documents that may help your case, letters of support from a physician, test results, and your personal narrative. What do you do if you're not satisfied with the insurance company's internal review findings? You may have to file an external review. Here's the website and phone number for the Indiana Department of Insurance. But remember, before you can request an external review, you must have completed the internal review process provided by your insurance company and received a final decision. If you have any questions or need additional information, all of our resources will be available on the Arthritis Foundation's advocacy webpage. If you have additional coverage questions, we encourage you to visit your coverage and care through Prescription for Access. This reference will help you better understand health coverage options and determine how your current plan meets your arthritis care needs and guide you through the claim denial process. The kit includes information, tips, and tools for consumers to get the most coverage and avoid or minimize claim denials. The kit also includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeals process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially those most vulnerable, tailored solutions to inquiries about arthritis and its management. The phones are staffed by licensed clinical social workers who provide expert answers to questions about access to healthcare, information about resources to pay for medications, and community resources. Thank you for listening to today's webinar, as we want to make sure that new state laws are being implemented fully so patients can enjoy their new protections.